I want to explain to you, there are 3 layers. In your uterus, it's written bulky. It is supposed to be bulky because you have been pregnant in past. And then it says heterogeneous. Heterogeneous means like this. They have written in your ultrasound both the diseases, fibroids and the adenomyosis. Fibroid is like putting a ball between the guitar chords. So when you open for the surgery, you can take the ball easily away and guitar chords will come back in the position. So if you see this, fibroid is circumscribed. It has boundaries. You see, so if you remove it, it will come out so easily. The good part is it's very small, 2.6, 2.5 centimeter is nothing. It's like this much size, like maybe this much. And here it's written, it's intramural, like it's deep in the muscle of the uterus, but in our report it's written subserosal. So but it could be just the angle, and it could be just subjective. So probably it's deep in the muscle, but it's very small size. You don't have to have the treatment. Every 3rd woman has fibroid. And just because we have good machines, everybody knows it, but not everybody needs treatment for that. Then next thing, this adenomyosis. You know what adenomyosis is? Like if you spread rice grain and the coffee beans together. If you mix the rice grain and coffee bean together, and then you're opening, maybe at home you can separate them within 3 days, 4 days, like taking your time. But when you open somebody for surgery, you cannot take that much long time. You cannot open somebody for surgery and just separating this. So what happens when we do surgery for the adenomyosis? We take the portion where is more coffee beans and less of the rice grain. But still, you take some of the healthy tissue and you leave some of the bad tissue. So adenomyosis surgery is not that perfect. Now question is, the reports are almost same. Actually, here they wrote 2 fibroids. They didn't write the size of it, but here they wrote 1 fibroid. They write intramural fibroid. They wrote subserosal is also there. So probably they missed here this one. Then your inner lining, which bleeds, which shades every month, that is completely normal. And then your cervix, the womb mouth, that is completely normal. Your ovaries, they are also normal. Here it's just the same, right? Your ovaries are normal. Nibothian cyst, it's just a normal thing. It never needs treatment. What's your age?
44.
Okay. After 40, when I was doing my residency, the age cutoff was 40. After 40, any bleeding problems, they put red flag symptom, they are called, and they warrant that one must take the patient into the operation theatre and take the tissue here, like old DNC, and take the tissue outside to be seen for a closer look under microscope. And then they see that somebody might be having some bad cells which can become cancer in the future, because 40 used to be that age. Now the age is not 40, it is 45. But trust me, it's not like a Cinderella clock. I used to work in Abu Dhabi. I found one girl, 37 years old. I didn't do DNC just because I was suspecting pre-cancer disease. What happened? She was bleeding like anything. I took her in theatre, and when I found the histopathology of the tissue, it was pre-cancer disease. So it's always better if you're bleeding that much. The question is fibroid. This fibroid cannot cause you anything. Even adenomyosis, they are pain symptoms. They don't cause bleeding problems. So you need to do in the old times we used to do DNC. In the modern times we do stereoscopy. What is the difference? When I used to do DNC in the past, I was just doing DNC and it used to be blind. I'm talking to you, how are you? How was your vacation? I'm talking to other people in the theatre and I'm taking the tissue outside just with the curate looking around, and I used to send it for histopathology. In modern times, we put very slim camera inside and Everybody, there's a big screen there, everybody's seeing the screen and we all are seeing, oh yes, that is a suspicious area, let's take that histopathology. Dr. Bushra, like I see everybody, the whole room, even anesthetists, everybody is seeing the screen and we all just decide, the surgeon decides. And if you see, there are suspicious areas. This fibroid is suspicious, these polyp, they are hanging like a chandeliers from the roof. We take them out and we send histopathology. If somebody has everything normal, we take the global sample like from here, from there, from there, from there, and I send it to, I will send it to histopathology and we'll see. If you're perfectly normal, we will reassure you and we might give you medication. If your symptoms are not coming back, nothing to be done. But if something in the histopathology, then I might have to give you treatment. There are, medicine is moving very fast. It has become really modern to tell people that they might be having some disease and which could be precancerous, and we can treat them before they become any bad disease. So for me, your ultrasound is perfect. Your endometriosis has no problem. You don't have pains, right? Forget about
pains. Pains means I have
during
pain.
periods.
Yeah. Sometimes every pain here, abdomen.
Every periods?
Not every period, but
but it's not. Is it that much?
Not that much, but it will pain.
Yeah. See, when we
Means
offer
like
treatment,
15 minutes it will pain. I will
that's it.
Yeah, 15
No
minutes.
problem.
Yeah.
I will tell you.
And I'm feeling very tiredness also.
During the periods.
Not only during the period.
This is another issue. You might be bleeding so much that it caused you anemia. So I will be very
It is 6 or something.
No, oh my,
Not 6, not 6.
Yeah, it is 10.
10.
So yes,
11.10
then
is
all the more reason you need urgent hysteroscopy. But I will tell you something about the endometriosis. You do not need treatment. When we give treatment, your symptoms should justify that. Are they intense enough that I put you under knife for that? Because endometriosis surgery is not simple. It's like a laparoscopy. Keyhole surgery, and inside it's not keyhole, it's a big extensive surgery. From I think you only need to see why you're bleeding and I can give the treatment at the same time. If I put Mirena, the hormonal contraceptive device, if I put it here in the clinic, it costs you $1,200 insertion price. If I put it in theater, because you're already in the theater, that will not cost you anything. It will just cost you the device, which is separate $620. Everybody $620 and $1,200 they have to pay here. But in theater, only $620. That will be the treatment also of the this bleeding problem.
What is that?
Mirena, the hormone contraceptive device.
Okay, it's like cord or something.
It's a coil, but with the
Coil, yeah.
hormone. It doesn't have a copper.
Copper.
Not copper
T
T. It will. You can say the T. It's like a Tesla model, but it's not copper T. It's a hormonal device. It releases hormone. It doesn't release copper.
Yeah, that reduces bleeding and all that.
Exactly.
Yeah.
That reduces bleeding like anything. It's a treatment of pre-cancer disease also. So just God forbid I get the sample after 7 days and it says it's a pre-cancerous disease and it needs treatment. We already treated and we will follow you up by the 6 monthly sample, that if that disease was there, in the past we used to do hysterectomy, uterus removal for all these patients. Nowadays, no. We just put the coil and we follow them up to see the disease is regressing or not. And most of the people, it does.
Okay, only coil or any other option is there for that without like putting coil?
But isn't it?
Oral pills.
But
or
do you
something?
think pills are friendly?
No, just I'm asking.
I will tell you,
which one
pills,
is better?
progesterone, when you go into your body, it has a side effect of osteoporosis or the brittle bones. So brittle bones after 40, and then you're about to go the menopause. So do you want to go your menopause with the brittle bones? No. I'm also big. I'm above 40. I don't take progesterone because I don't want to enter my menopause with the brittle bones. I have to prepare my bones before getting menopause. So I will not say take progesterone by mouth. Isn't it better that in a micro doses is just go inside and work where it's just supposed to work, rather going into my whole
Yeah, you're
body?
right. In fact, just sorry to interrupt you.
Yeah.
This another gynecologist, she
Yeah.
suggested to take the oral pills, and then I spoke to someone else. They said better you take the second opinion, so we came to you. That is what. That is why the oral
And-
tablets were given. Yeah,
Yeah.
it is. Yeah,
You
she.
started it?
No, we didn't buy.
started
Yeah.
it.
I did not buy.
Hysteroscopy will be affected. If you take the hormonal pills, I will not get the sample correct.
No, I did not start.
They suggested, but we were quite hesitant because it is
Yeah.
not of the thing. I was told that it could have some side effects.
Yeah.
I mean, because
It goes to the whole body. You know, Myrena, it goes very little amounts, like
Yeah,
the
this
side
one.
effects will be less. Drospelina. Oh my, okay, fine. I have a lot of reservation to give hormones to anybody who's above 40 because you know we are at the more risk of clotting. You understand? We can make clots above 40. So I have reservations giving hormones, especially the oral ones, to anybody who's
Yeah,
above
that's
40. Yeah. So let's see. I will be sending approval for hysteroscopy to see. And forget about fibroid, forget about endometriosis. Endometriosis is a special kind of endometriosis you have, which is adenomyosis. But if it is not causing you symptoms, no need to go under knife for that. Because you can become menopausal anytime.
Is it possible
Endometriosis,
it will grow bigger? No.
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 Endometriosis doesn't cause cancer. Just be sure about that. And you will be, whenever you will go menopause, it will regress because it needs hormone feed. Once we are menopausal, that feed is gone, and then people regress the disease. And especially even at that time, you don't have symptoms. Why, no need for treatment.